Here are a few of the stories on this week's VA News.
151 mental health summits, one for every VA medical center, are in full gear through September.
VHA uses whiteboard videos to draw attention to helpful messaging.
And how the Tillman Foundation has kept this veteran focused on a greater purpose.
I'm Catherine Yamito from VA, interning this summer with the VHA Office of Communications.
And I'm Jose Llamas with the Office of Public Affairs. Stay with us. Catherine and I will be right back.
VA has enthusiastically begun the mental health summits required under a presidential order issued earlier this year. The first was at the San Francisco VA Medical Center. That was followed by 5 other summits in July in Toma, Wisconsin, the Manhattan Medical Center, New York, Wright River Junction, Vermont, Phoenix, and Kansas City. All of the others are scheduled in August and September. Check out the map on the screen to find a summit in your state. Just point to a state and click to download the schedule. VA hopes the summits build or sustain collaboration efforts with community providers to enhance mental health and well-being for veterans and their families. VA Undersecretary for Health, Dr. Robert Petzel, talked to us about the summits and what he hopes they will accomplish.
What do VA and the administration hope to accomplish with these mental health summits?
Meeting the health care needs of veterans and their families is one of our highest priorities. We've been expanding our own resources to do that, but we also need to be collaborating and coordinating with our community partners. We need to engage local, faith-based and nonprofit groups, veteran service organizations, community health centers, and others in providing the best possible mental health care and services to our veterans and their families. We're already successfully collaborating with community partners to help us reach our goal of ending homelessness amongst veterans in 2015. And we believe we can achieve similar results with mental health care. Just as homelessness is an issue that's too big and too complex to tackle on our own, we can't fully address the mental health care needs of veterans and their families if we're not working hand in hand with local communities. That's what these summits will help us accomplish.
What information and resources might a veteran obtain at one of the summits?
We're strongly encouraging facilities to invite veterans and their families to these summits. For veterans, these summits are an opportunity to learn more about programs and services that are available to them through the VA, as well as the resources that are available to them in the community. It's important to remember that the majority of returning service members successfully readjust to life after deployment. But for those who need help, it's imperative we bring our combined resources to bear in providing the care and supportive services they need, deserve, and have earned. We need to do all we can to raise awareness of the resources available to veterans and get rid of the stigma around seeking mental health care. We want veterans to know that seeking treatment for invisible wounds of war isn't a sign of weakness, it's a sign of strength.
VA recently met the administration's goal of hiring 1,600 mental health professionals in less than 9 months. What does this mean for our veterans? How will they benefit from this?
Last year, we provided specialized mental health care to more than 1.3 million veterans. That number's been rising every year, mostly because we've improved our screening processes to identify veterans who may be in need of mental health services. Reaching that hiring goal and filling more than 2,000 existing vacancies means that we can better meet the needs of veterans. We now have a workforce of more than 20,000 mental health professionals nationwide. It's the largest mental health program in the country and one of the largest in the world. I'm proud of all the hard work our staff did to get these positions filled, but that doesn't mean we're slowing our efforts. We'll continue actively recruiting to fill any vacant mental health positions. We need to make sure that veterans can get the care they need, when they need it, where they need it.
Whiteboard videos have caught on as an eye-catching advertising tool from everything from sports, entertainment, retail, and just getting your message out. You can find all kinds of whiteboard videos and tutorials on how to build them on the internet. The VHA National Center for Health Promotion has posted them online to promote healthy living. Check out this whiteboard video on the benefits of being more active.
Jen and Yolanda have been friends since basic training. They do almost everything together, from their usual morning coffee to checking out the latest movie. But one thing they don't do together, work out. Like many Americans, Jen can't find time to exercise, or it's just not a priority. Yolanda, on the other hand, does find time to work out. And guess what? She feels better, has more energy, and sleeps better at night. What Jen doesn't realize is she could still find activity around the workplace, like standing instead of sitting, taking the stairs instead of the elevator, parking further away from the entrance. She can do simple things that will have huge long-term impact. Some physical activity is better than none. To achieve substantial health benefits, adults should do at least 2.5 hours per week of moderate activity. Cardio should be performed in episodes of at least 10 minutes, and it's okay to spread activity throughout the week. Health benefits include lower risks of heart disease, diabetes, some cancers. Regular physical activity prevents weight gain, reduces depression, and improves sleep. These are just a few. So, be active in your own way. Carry groceries, mow the lawn, do yoga or Tai Chi, walk the dog, dance, swim, or golf. All are great examples of muscle strengthening, cardio, and stretching activities. Find what works for you. Make the time and talk to your healthcare team. Set your goals to be physically active. VA Healthcare is defining excellence in the 21st century.
Last week, we shared a quick look at the Pat Tillman Foundation and its 4th Annual Leadership Summit in Chicago. We told you of the success of the foundation named after the NFL star and U.S. Army Ranger killed in Afghanistan in 2004.
To date, the foundation has raised funds for 290 Tillman military scholars in 34 states. The newest class of Tillman scholars was introduced at the recent Leadership Summit.
Here's a look at former Army medic Sam Innocent, one of those new foundation scholars.
At the 2013 Pat Tillman Foundation Leadership Summit in Chicago, scholars were gathered together to network and were given the tools to live out the motto, service, learning, and action. One of these veterans is Samuel Innocent.
And I'm a poor kid from a single-family household in Brownsville. It was my mom and my 3 sisters. We made best with the best that we had, with everything that we had. I moved around a lot within New York when I was younger. Every time we moved, the only people that I knew in the school or in the neighborhood were always my sisters. So I just had to always adapt and make new friends. Some of them I kept for life, some of them I learned what I had to learn, what life had thrown my way from them. And then we kept it moving,
Always having to adapt to a new situation, Sam eventually came to a point in his life where he sought stability.
I was at a rough point in my life in transition. I was going to Farmingdale State University and working at Walmart. So a lot of ends didn't meet for me. So my next and my most viable option was to join the United States Army.
It was in the Army Sam felt the call to serve others.
I served 7 years in the Army. Once you have that aptitude, that instilled character to serve your nation, to contribute to the greater cause, the greater purpose, it never leaves you.
Sam Innocent is now a student at City College in New York. With the scholarship paying for school, Sam has time to give back to the community he came from.
Advocate on behalf of low-income neighborhoods. That's always been my niche, to try and help people who may not have the tools or the knowledge to kind of help themselves at first. I'm a mentor in the In Arm's Reach program, which mentors children who have at least one parent in the household who is incarcerated. So, and it's usually most likely the father that's incarcerated. So we step in as mentors, we give them tutoring, we take them out, we kind of try to not necessarily fill the gap, but provide a buffer, an escape almost from, the mundane everyday city life, that where kids tend to go from school to activities that may not be conducive to what American society would want them to do in life. So we keep them off the streets. We take them bowling. We mentor them. We show them fine dining skills, which I'm learning as I go myself. Which fork to use is always the number one question.
Service, learning, action. Sam Innocent lives these values, and with the Pat Tillman Foundation Scholarship, he will have the help he needs to take them as far as he can.
VA Research Currents has a new format. The print edition has been redesigned and expanded and will come out 4 times a year. The online edition, also redesigned, will be updated monthly. The summer 2013 edition of the Research and Development newsletter is available at the web address on the screen. The publication shares key findings, technology horizons, ongoing research, a scan of professional journals, and career milestones for VA researchers. In this edition, hormone findings point to possible therapy for traumatic brain injury, a study that links combat injuries to changes in the brain's cortex. Agent Orange is linked to aggressive prostate tumors, how the VA Case Western Reserve Team in Ohio is working on a simple but elegant solution for preventing pressure ulcers, and ongoing research on finding ways to get older patients to move more, and how a blue dye method may be boosting the power of colonoscopy to ward off cancer. Download the entire Research Currents in PDF format and read it online.
Around this time each year, Hospitals and Health Networks releases its annual Most Wired Hospitals Magazine edition. Most Wired hospitals are chosen based on a survey of 1,700 hospitals aimed at ranking hospitals that are leveraging health information technology in new and innovative ways. A handful of VA's 151 medical centers and other healthcare facilities have made previous lists. 16 VA healthcare entities made the 2012 list. The 2013 list includes all VA medical centers, healthcare systems, networks, and CIO offices. The full list of 2013's Most Wired hospitals and the entire report can be found in the July HNHN cover story, detailing results available at www.hhnmag.com. In a memo to VA facilities and system directors, Undersecretary for Health Dr. Robert Petzel said, "The best experience possible, integrating health IT into our everyday processes throughout our vast healthcare system has helped us to accomplish that goal. This recognition and this year's 10th anniversary of the introduction of VA's personal health record, My Healthy Vet, indicate we've made great strides in accomplishing our goals, and we're eager to build on this progress. All VA medical centers, health systems, VISNs, and OIT organizations may use the Most Wired trademark logo in their marketing programs."
Did you know? One of the big names in social media recently gave VA a big Facebook compliment for its fight to end veteran homelessness. Craig Newmark is the creator of Craigslist. The technology mogul visited VA Central Office last month to talk about his support of veterans and a desire to maximize that support. When Newmark returned home to California, he posted this on his own webpage, Craig Connects. The U.S. Department of Veterans Affairs awarded almost $300 million in grants for homeless and low-income assistance efforts last week, 3 times what the agency spent on that program last year. That's big, reminding us to all lend a hand. That's all we have for this show. Thanks for tuning in today. I'm Catherine Yamito.
And I'm Jose Llamas. Have a great day and rest of your week.